I think they've been around for a long time, certainly some more than others. Peels, IPL, BBL, you name the initials. Are these things working?
Oh, absolutely. But it's like anything. These are basic tools. They're not commodities, and it all depends on the skill of the person doing them. But yes, I mean, BBL and IBL, which are kind of two sides of the same coin, but different technologies, basically they're great for getting out red and brown and to a certain extent truly rejuvenating the skin.
Let's take a break and say, what are the patients asking for anyway? They want to look younger. They want to be rejuvenated. They say, Dr. Cook, I want something done. I don't know what I don't want to have done, but I want something done, and I want you to decide for me what I should have done.
There's a spot here that
Right.
And, you know, quite rightly, we have ways of talking to them saying, well, you know, you've got some sun damage, you have aging changes. This leads to the appearance of brown spots, red spots on your face, wrinkles, big pores. A lot of it's sunlight exposure, some of it's just the aging process. And we have multiple tools to help fix it. So you asked the question about what are those tools? Well, we can use peels, which make use of chemicals to change the quality of the skin and improve it. Or we can use light devices, which use light energy to transform the skin. So John, tell me, how do you decide for the average patient who's coming in to see you, how do you pick between these things and which one's better for the patient?
Well, a lot of it comes down to talking with the patient, of course, and finding out what their priorities are. Now, some will come in and say, well, just take a look at me and tell me what you think is best. We often use a device known as Visia because it captures the images of the skin in different contexts, pores, wrinkles, etc. It's fun because you can kind of match their progress. So your selection is going to be based on that. A lot of times I think we shouldn't forget medical grade products because when used intelligently, they can really be tremendously helpful. And it's like a step ladder, you know, the bottom rung is the medical grade products. They may get some people to where they want. I think that broadband light or intense pulse light is tremendous if there's textural issues or particularly pigmentary issues, red and brown, a little bit of texture, but not so much. We have other things that are better for texture and wrinkles.
So it's not one treatment, it's a lifetime of treatments to keep your skin healthy and rejuvenated. And that means that you're going to combine these light devices with products, because the products are going to offer you maintenance as you go forward. And then every year after you've had exposure to sunlight, you and I both live in sunny environments, right? People need to get treated. I look at it as like fall cleanup, spring preparation.
If you want some more information on this or other subjects, please, theplasticsurgerychannel.com.